The following program is sponsored by Allegheny Health Network. CBS Eye on Health. New lungs, thanks to a new partnership with Darieth Chisolm.
Hello there and welcome to another virtual edition of CBS Eye on Health. I'm your host, Darieth Chisolm. Thanks for being here. Today, joining me by video chat is Lori. And Lori needed a double lung transplant due to her worsening lung disease. Lori, thanks so much for being with us today.
Thanks for having me, Darius.
Absolutely. So why don't we get started with you telling us a little bit more about your journey with COPD and what COPD is.
COPD is chronic obstructive respiratory disease, and it does mess with you. It's like a black ghost in your lungs. It makes it very difficult to breathe. It restricts a lot of things that you do because you can't breathe, and it just makes life pretty miserable.
Sounds like it was. I mean, affecting your breathing ability certainly can be quite challenging. But of course, that then led you to seek help, and you also then decided to see Dr. Singh. So tell us a little bit more about that.
That was very scary. When the word transplant came up, I wasn't ready. But I went down to see Dr. Singh, who was a very intelligent, very personal doctor. Talked to me about everything with transplant and anything that could happen, anything that could go wrong, could go right, how the process goes. He just, really built it up, made it sound good and like something that I was ready for. And that I really wanted so that I could enjoy the grandchildren and my animals and life, period.
Yeah, and let's talk a little bit about your quality of life up until this point, dealing with COPD. What was that like for you?
Bad. I was constantly on oxygen. I had to fight a 50-foot airline. I had cats and dogs jumping on it. No matter where I went, I had to have a couple tanks with me at all times because the more you try to do, the more oxygen you go through. So it kind of levels your life where this is what I can do and can't do, how long I can and can't be gone. And you have to just adjust everything in your life according to that oxygen tank.
We'll talk a little bit more about really becoming a transplant candidate and all the steps that you had to take to doing that in just a moment. But I'm curious to know, how did your family respond to this? What were they talking about and how were they feeling?
Well, there was a lot of mixed emotions there. I was all for it from the beginning because I know what my life was like. My family, as far as my daughter, my sister, those people were all for it. They were there for me.
You make this decision, and then you discover there are several steps that you need to take to be a transplant candidate. Tell us about those steps.
Well, you have tons and tons and tons of testing, blood work, x-rays. They kind of check you out head to toe. I had to make a trip to Baltimore first and get more testing done, meet everybody, like I said. And Highmark was great. They paid everything for me to get down there and back while we were there. It was no financial burden whatsoever. So it worked pretty good.
Great. How long did this take?
From start to finish, about 2 years.
Wow, 2 years. So now you're traveling back and forth to Baltimore to meet with the Johns Hopkins transplant team. Tell us more about the folks there.
When I was there,
Yes,
it
the
was
team that you were working with.
it was crazy. They had you running from one end of the hospital upstairs to the other end of the hospital downstairs. You were all over the place. I met so many people, I couldn't tell you half of their names, but you do meet a psychologist to help you through it, a nutritionist, you meet the surgeon, you meet the regular doctors. I mean, there's a lot of people involved in it, a lot of medical staff. It worked well. I was comfortable when I came home.
Yeah, and obviously there's a lot that goes into even being on the list. Of course, just because you're on it doesn't necessarily guarantee that there's a match. That had to be a huge benefit to you as well. But you received this call though that you have a set of lungs. When was that, and how did that make you feel?
I was in awe. I couldn't believe I got the call.
And I understand that even that first set wasn't necessarily a match, so you had to go back on the transplant list and wait again.
Right. I waited, and then 2 weeks later, I got a call, and 2 weeks after that. But the third call actually sent me to Baltimore. And by the time I got down there, the lungs were no good. But the transplant doctor wanted me to hang out because he had more coming in. And uh, I just, I was very anxious, very nervous, I guess, although I don't feel nervous. But I had to wait, and I wanted to come home. I figured if I wasn't going to get my lungs, send me home. But he said, no, no, let's wait. Your insurance might not cover it. We'll do this. So I waited, and finally I got my lungs. But they kept setting up an OR time, and then something would be wrong with the lungs, and then there'd be another OR time, and something else would be wrong. So it was a real crazy journey.
Yeah, yeah. And we've got so much more that we want to talk to you about. But before we head into our first break here with you, I'm curious to know once you finally realized that you were getting the transplant, they found a match after 4 tries, what were you feeling then?
I wasn't feeling anything. I think I was in shock. I mean, I was happy, I was glad, I was anxious, but I don't think that I ever really got nervous because it was something that I wanted so bad and that I needed so bad. And I told everybody that I was going to do this and I was going to beat the odds and I was going to kick butt. And I did. I when once I was done with my transplant, I beat all the odds. I set the bar high, and I said, that's us Pittsburgh women.
I love it. I love it. That's so great that you were kicking butt. We're going to learn more about the butt you kicked after a while, but we're going to go into a break. And when we return, we'll talk with Lori's lung specialist at AHN about joint transplant program with Johns Hopkins Medicine. Stay with us.